evening. I'm Andrea Anderson.
I'm Brian Allen. South Dakota one step closer tonight to making childcare a little more accessible for some people in the state.
State House reporter Grant Green has more on how proponents hope this effort will extend to all families in need around the state. He is joining us live from here with our top story tonight. Grant, good evening.
Good evening, Brian and Andrea. Well, opponents say that House Bill 1132 will lead to a slippery slope of staff and employees of all these different public service fields expecting child care subsidies of their own. But proponents say if House Bill 1132 passes, they simply won't need them. Child care around the country has been tough to access, with costs rising over 200% in the last 3 decades. In the Sioux Falls community alone, the closure of services from Apple Tree and Lutheran Social Services have only made the issue worse.
We cannot let the pursuit of perfection stand in the way of progress. I urge the support of this bill. More importantly, to stand with our child care providers, our workforce, and our families.
Brookings Senator Tim Reed is aiming to address one of the root causes troubling child care: staffing.
Each new child care worker brought into the field can open at least 10 additional child care slots, benefiting both families receiving assistance and those paying the full tuition.
House Bill 1132 requires the Department of Social Services to exclude earned and unearned income for its child care assistance program if an applicant is employed through a child care service provider. Child care workers would be eligible up to those making 300% of the federal poverty level, higher than what is currently the maximum eligible income, 209% of the federal poverty level.
Somebody's going to have to pay that cost. And so the 209% is the first thing we'll look at. Well, maybe for all those who don't choose to work in child care, maybe they'll have to reduce from 209% of the FPL to 185% of the FPL.
Most reimbursed child care rates fall around $3 to $4 an hour, depending on the program. DSS Secretary Matt Alhoff says this bill is putting the department in a tight spot.
We are doing our best to keep up with the market as inflationary pressures to retain staff happen on our providers in South Dakota. We are working very earnestly to keep up with those paces.
Althoff added that Social Services is currently in the middle of changing their rates, which take effect next year, meaning this bill will force the department to make significant changes to policies that will only last for 6 more months after the bill takes effect. And the Senate Health and Human Services Committee did pass the bill on a 5-2 vote. Some members did show some hesitancy about this bill expanding government. It will now be heard on the full Senate floor. In Pierre, Grant Green, Dakota News Now.